Thank you. As you know, SIDS and Kids was started by bereaved families that unfortunately had a loss through either pregnancy, SIDS or a neonatal death. So our recommendations have obviously been taken by these parents, but since then we've also done a lot of research. So our recommendations are not only to reduce the risk of SIDS, sudden infant death syndrome, but also to prevent sleeping accidents that could be fatal. So our recommendations are evidence-based. The research has indicated that this works and that this has saved lives. So just a little bit about ourselves here in Western Australia. We reside in the suburb of Kensington. We're non-government, not-for-profit. So we heavily rely on the community's donations in order to allow us to provide services such as education and grief and loss professional counselling. And Red Nose Day in June is the biggest month for us in order to sustain what we do and what we assist with. So the biggest mission that we have, obviously, is to save as many lives as possible through pregnancy and childhood. So we do attend to any sudden and unexpected death of a child up to the age of 12. So trying to understand what sudden infant death syndrome is can be difficult. Difficult in the sense that we do not know what actually causes it. Now, we have come a long way since the 80s where research has identified risk factors. Now, these risk factors are things that we know now can put into place a baby at a higher risk of SIDS. Now, our recommendations are to reduce the risk. We cannot say that it'll prevent because we don't know a cause, so therefore we cannot prevent currently. We hope to, but at the moment we can only reduce. So what do we know about SIDS? Well, we know that when a baby goes to sleep, unfortunately for some, they don't wake up. And for that, we find that these babies can be vulnerable to certain things. Usually, when SIDS is to occur, it can occur up to the age of 1 year of age. So the definition of SIDS is from up to 1 year of age. However, if we're looking at an age risk where it occurs the most, it's up to 1 to 6 months of age. And in regards to risk factors, we know that there are certain external or environmental outside stresses that can increase the possibility of SIDS occurring. And these are things like tummy or side sleeping, overheating, face and head covered, or cigarette smoke exposure. We know that these things, if we remove them outside of the baby's environment, the risk of SIDS is remarkably reduced, at least by 50%. So when we look at risk factors, we look at the sleeping position, we look at the bedding. So the bedding in regards to doonas, bumpers, pillows, they are risky. We're looking at cigarette smoke, sharing a sleep surface with your baby. Now that may be that you take your baby into bed with you to sleep, or it may be that you share the couch just to have a cuddle time, but then you fall asleep. These things can increase the risk of SIDS, but also a sleeping accident. Having your baby's head and face covered, soft sleeping surfaces. They're things like sheepskins, for example. Okay, we'll go through how they impact a baby. Water beds or items such as like beanbag items that you place a baby in, initially maybe to feed at 4 months of age or 6 months, but then the baby falls asleep and you walk away. They're too soft for a baby to cope in. Soft toys. Soft toys we do not recommend are placed in a baby's sleep environment unless after the baby is old enough to cope with it. So that's over 1 year of age. Okay, so our recommendations not only will reduce the risk of SIDS, but also reduce the possibility of a fatal sleep accident, are to keep your baby on its back to sleep. So every time the baby is placed to sleep, whether in a cot, bassinet, pram, on the floor, wherever, start the baby on its back to sleep at the commencement of that sleep. Make sure that the sleeping environment, there's nothing there that can encourage the baby's head or the face to be covered. Keep the environment that the baby's in smoke-free. Have a safe sleeping environment, whether it's the night time or the daytime. Have the baby's cot or bassinet in the same room as you. Now that is really good practice for at least the first 6 months, if not up to 12 months. We know that if you have the baby in the same room as you and it's smoke-free, then it encourages parents to use their intuition to actually check up on the baby quite regularly rather than in a separate bedroom and breastfeed baby. So when we're looking at back to sleep, we're also encouraging tummy to play. So we want babies to have an association of being on their tummies. It's very important for their development, but it's also very important for their core strength. Their strength in the abdomens to assist them to know what to do once they're in that tummy position. And when they're old enough, they can do so quite competently. Why is it then that SIDS and kids recommend back to sleep and say that tummy sleeping is risky? There's various reasons why it's risky. And one of the biggest concerns for some parents is that the baby, when it's on its back, wakes up a lot, and when it's on its tummy, it sleeps really, really well. Okay? And sometimes some parents or carers will say that the tummy position increases the risk of choking rather than on the back. Both of these can be explained by, one, the tummy position unfortunately places a baby in a very profound sleep, more profound than normal. So their ability to wake up when they're facing some form of danger, whether it's environmental or whether it's internal. So internal meaning heart, breathing, overheating, blood pressure, any of those internal systems or external systems can, by tummy sleeping, make it a little bit more difficult for the baby to respond quickly and appropriately. From a choking perspective, the tummy sleeping, because they're in that profound, deeper sleep, it also reduces their ability to swallow. So the swallowing reflex isn't constantly doing the job that it should be, compared to a baby that's on its back. Obviously, the tummy position also places a baby at risk of face and head covering. So there's a risk there of suffocation. We'll now look at an anatomical feature of a baby on its back, just to further explain why a baby would not be at a higher risk of choking if it's on its back. When a baby's on its back, we know that it is able to awaken more quickly. Its ability to awaken from danger and to respond is much, much quicker. So here what we have is a baby on its back. This is its anatomy. This is the airways. So this tube is going to the lungs. This here is the food tube, and the white in the food tube is obviously representing vomit. This here is the back of the throat. So when fluid comes from the stomach and travels up the food tube down to the back of the throat, it will pull for a little bit until the brain recognises that it needs to swallow. In order for the baby to swallow during sleep, it needs to be in light sleep. So every time you see a baby sleeping and it's moving, that's light sleep. So the baby in sleep responds by the brain saying, fluid is pulling at the back of the throat, move into light sleep and swallow the fluid. And it does so. When a baby's on its tummy, we know that it's in a more profound sleep, delaying its ability to respond the way that we like it to, but also the position via gravity encourages fluid to enter into the airways. So we have here everything in the reverse now. We have the food tube up the top. We have the airways down the bottom, closest to the mattress, okay? And food is going to travel upwards and enter into the airways before it has a greater opportunity to pull at the back of the throat. So with the fact that the baby is possibly going to be delayed to wake up, but also the gravity of this position will encourage fluid to enter into the airways and potentially increase that risk of the baby actually choking. So the recommendation of having the baby's head uncovered can be done in 3 different ways. We can have a wrapping or swaddling. We can have the baby's feet to the bottom of the cot, and we can have a safe sleeping bag. Now, if you choose to use the wrapping, it's about the baby being arms in. Now, not all babies like this technique, but for babies that find it difficult to sleep, wrapping is one thing that can help. However, when you're wrapping, you need to make sure that it's safe enough so that the blanket or whatever you're using doesn't cover the baby's face. But it also encourages the baby to still move. We want movement during sleep. So if the baby needs to respond the way that we want it to, out of danger, it needs to be able to move. When the baby reaches 4 months of age, wrapping with arms in must stop. So arms out after 4 months of age is required because it's at that early age that babies are seen to move from their backs and roll over onto their tummies. That is normal. That is a great development milestone. So if your baby is wrapped with arms in and is starting to roll over, this is very risky because the head is the heaviest part of the body and therefore cannot lift its head up by itself without the aid of the arms on either side of its body. So arms out after 4 months if you're using a wrap or a swaddle. The feet to foot can be started at any time from birth onwards. Make sure that the blankets, if you're using blankets, that you actually have it no higher than nipple line or chest so that the baby doesn't grab it and pull it over, and that it's tucked on either side and at the bottom base of that mattress. The sleeping bag, any sleeping bag, as long as it's safe, that is no hood, a baby should not sleep with anything over its head, and that it preferably has a TOG value, so a value of thermal insulation. The ideas of the sleeping bag is so that you don't need to use blankets or bed sheets. It's an alternative use. Overheating, whatever way we dress our babies or wrap our babies in or place blankets on, we can all have the potential of overheating the baby. And in winter, we're very good at overheating because we're very good at trying not to make the baby get cold. And unfortunately, that's where our statistics of SIDS from overheating increases, all right, because we're just so good at doing that. So just be careful and just make sure that you always check your baby's temperature just by touch, right, at the back of the neck or at the chest here. Just make sure that by touch you feel that the baby feels warm, not clammy, not wet, because wet means it's sweating, and it's sweating because it's very hot. A hot baby will not wake up and tell you that it's hot. A hot baby will stay sleeping and become in a very profound sleep. So the baby will continue on sleeping and sleeping and sleeping. A cold baby, on the other hand, will wake up and tell you that it's cold. So it's better to be on the cooler side than on the warmer side. Smoke-free. Basically, if you, your partner, or anyone else in the family or friends are smokers, just encourage that the baby is minimised to that smoke. We know that over 60 studies have demonstrated a direct link with cigarette smoke and SIDS. And some of the research is showing that it interferes, particularly during pregnancy, it interferes with the maturity of the part of the brain that controls breathing and heart rate. So smoking outside is one strategy. Allowing the smoker to extend its time of touching the baby from the last cigarette is another. So this is how your baby's cot or any environment that it sleeps in should look like. A cot bought here in Australia will all have an AS number as well as a porta cot, an Australian safety approved for babies to sleep in. If a product for sleep does not have an AS number, it means that it has not been approved by Australian safety standards. Okay? However, that product will have had a safety from its manufacturers to prove that it's sturdy enough to actually be purchased. So a bassinet, you won't find an AS number, okay? However, you are required to have a look at certain items of safety if you wish to buy one. So make sure that the bottom and the top of that bassinet is at least 300 millimetres in height to prevent a baby from falling, that the mattress is at least 75 millimetres thick in firmness, no decorative ribbons, bows, anything loose that can be a hazard for a sleep accident. If your baby's starting to roll over from back to front, must move from the bassinet now into a cot. It is not a safe place. And never use pillows, quilts or toys in a bassinet, just like in a cot that you wouldn't either. So we recommend, because the cots have an AS number, that the baby can go into a cot from birth. So obviously, we don't want the middle picture, all right? It still happens, but hopefully through education, we know that the better area for safety for the baby is this one on the left. If you're going to sleep a baby with you, intentionally or unintentionally, never, ever, ever choose to do so on a couch. All right, that's one big thing that we say, please don't. All right? Because couches are a soft surface and they have far too many crevices where a baby can become trapped. If you intend or unintentionally bring baby into bed with you, look at the environment that the baby's coming into. Ensure that you know that your adult bed is not Australian safety approved for a baby to sleep in. Okay? That the bedding that we use as adults, it's not the same for a baby. The baby's ability to cope with adult-sized bedding is too difficult for that baby. So, if you are going to bring the baby into this bed, look at the cot, this picture here, and see how you can replicate that into your adult bed. So no doonas, no pillows, no extra children, no animals. Okay? Room sharing is what I said earlier about having your baby in the room with you. Because you're more in tune with your baby's ability to respond to it, and we've learnt that through various cultural groups, reduces the rate of sudden infant death by 50%. And breastfeed baby. We know that breast milk is brilliant in so many different ways, but we know now with a sudden infant death, on its own, it reduces that by half. Okay? So, anywhere and everywhere the baby sleeps, not just in a cot, in a pram and in a car seat. Remember these recommendations, because accidents and SIDS has occurred in prams as well as in car seats. So, that's all. I hope you've learnt something.